Friends, did you know that over 60% of your first-time clients are never coming back to your business again? They are going to your competition. That is so painful, and it doesn't have to be that way. That's where Maya comes in. Maya is the ultimate marketing software for the beauty and wellness industry. We have a proprietary funnel utilizing special algorithms to help connect the right consumers with the right providers at your business. So what does this mean? This means Maya helps you get higher spending clients you love to work with who stay the long haul. If you want to increase your revenue, increase your client count, increase your average ticket, and increase your new client retention, then you need Maya. Go to the link in our show notes to get your demo of Maya set up. Or go to joinmaya, that's MYA.com, joinmaya.com, and see why over 500,000 consumers have trusted Maya and the businesses that we work with to find their perfect beauty and wellness pro. We have your back, we always will, and we promise you will love Maya. Thank you for joining me. This is Katie Whitledge with a Beyond the Technique podcast. We are talking about your hormone health in 2025. It's wild to me that I started this industry in my, kind of early 20s. And if you would have asked me about hormones, I would not know anything about it. I would have probably associated just with having a period. So it was like, fast forward, you're having kids, you're aging so beautifully, of course, due to the industry that we're in. But hormones are a real thing, and we're seeing this kind of show up in early and earlier ages of people. So I have my favorite hormone expert that I've ever worked with here today. You are in for a treat. We have Karen Hanson here. She is the founder of Essential Health. She is a nurse practitioner specializing in women's health. She also has additional credentials with functional medicine and working in men's health. In fact, almost 40% of her clients, or patients, I should say, are men. So this is so interesting. No matter who is here listening today, this episode is for you. It's your health. And if you don't have health, you don't have anything else. So let's dive in. Without further ado, help me welcome Karen Hanson. Welcome to Beyond the Technique.
Thank you. Happy to be here.
Well, I'm happy that I found you all those years back, and you've really been there for me throughout all of the ebbs and flows of my professional life, of being a mom, of trying to get into the best version of myself and losing weight and all the things. So I just want to first off, thank you.
Of course. My pleasure.
But
fun working with you.
I know it's just, we have fun. No, it's good. Okay, so let's go to you choosing the path of more like the functional medicine and hormone side of health. Tell us a bit about your medical industry journey.
Sure. So traditionally, I was raised in a very Scandinavian Norwegian family where we grew up growing herbs and using more natural methodologies for healing and stuff. And then went to nursing school, which is very, traditional Western medicine. And just I worked in labor and delivery for years and thought I was going to be a midwife, and then realized I wanted to help women beyond the scope of pregnancy and childbirth. And so I went down the path of a nurse practitioner in women's health and worked in a very successful OB/GYN practice in the Chicago suburbs for years, and just started to see some limitations with what Western medicine can accomplish. And, Western medicine is great if you break a leg or you need surgery, but to really reach optimal health or to heal and repair from certain things, it's just limited. So I worked thankfully in a very supportive practice, and they were like, if you want to open a functional medicine wing, go ahead and do that, which was great. And then, so this was back in the early 2000s. And women would start to say, okay, you've helped me so much. Can you help my husband? Well, no, I'm in an OBGYN practice. So that kind of led me down the path of, researching and studying further so I could help all people. Um, and just a little bit, I learned from my patients, right? And so people would come in and say, I have this issue. I can't lose weight. Okay, I'm eating well, I have a personal chef, a trainer, why am I not losing weight? So that would push me down the path of let's go study thyroid deeper. Let's see what happens when hormones change with perimenopause. So I'm always learning. It's never ending. But just being able to really practice outside of the scope of the limitations of a bigger healthcare system gives me that freedom to find the answers for my clients and help them reach that health goal that they have.
I'll never forget you sharing with me that one of the reasons you left is because insurance really prohibited the amount of testing that you could do.
Yeah.
So I like that you brought that up because it isn't one size, one path fits every single person.
No, not at all. And it's more than just limiting the tests you can do. I'll still, even though I don't use insurance anymore, still will get letters from insurance saying you should prescribe this med, not this for your patient. And it's like, no, you're not the practitioner. So just keeping that out really helps.
Yeah. Okay, so let's talk hormones. Why is hormone health so important in regard to our overall well-being and our ability to have long-term quality of life?
Well, if you look up the definition of hormone, it is basically the essence of life. And so when we have an imbalance or we're losing hormones, um, all systems don't function correctly. And so it's how you're aging, longevity, but also, fertility and just living in balance and feeling good.
Yeah. Okay. So this is why I came to you. After having our first child, I knew something was wrong and I started looking up the symptoms of postpartum depression. And I was like, well, that's not quite it because I just know so many people struggle with that. And it wasn't until I met you that I didn't feel like I was going crazy, that I really had valid things happening. And you were like, holy crap, your hormones are tanked. You're not even producing, So I think everybody should be looking at their hormones. Tell us a bit about it. I mean, how many hormones do we have? Is it different for men and women? And what are some of the main things that you tend to look at to help people?
Sure. Well, the main sex hormones that we think of, are estrogen, progesterone, and testosterone. Now, both men and women have all those hormones, but obviously in different ratios. So men have much higher testosterone than we do. And we have three different estrogens that are dominant in different phases of our life. And so like there's an estrogen that's dominant when we're pregnant, estriol, and there's one that's, the big estradiol main one. Um, Men need a little bit of estrogen and some progesterone, and we need more estrogen and progesterone and less testosterone. But it works very similarly in both sexes, just not as dominant in one sex over the other.
Okay. And then what is usually, did those have an impact on thyroid? And is thyroid
Right.
a hormone? Am I thinking about that
It
right?
is. Yes, it is a hormone. We have several other hormones, but thyroid is very closely tied, I think, especially in women's health, to hormone function. If you just simplify it, our main endocrine organs are our ovaries and thyroid, right? And so what the ovaries are doing somewhat is regulated by what the thyroid is doing. And inversely, when, we start perimenopause and the ovaries aren't functioning like they always did, that can have an impact on the thyroid. So definitely very close tie. For women, I don't see that strong of a tie in men, but again, they're not cycling every month like we are, and they don't have that dominant estrogen.
Okay, so how young is too young to look at hormones? And like, what are the signs that you have imbalances that you need something to be looked at?
Yeah, well, that again very much varies per person and what you're looking at hormones for, right? So if it's, I want to have a baby, that's a different, that happens in 20s and, early 30s, of course. But most of us, if we're looking at it from just like a perimenopause, menopause perspective, we actually start to change our hormones in our late 30s. So just being very aware of when your cycles are changing. Oh, I never had PMS like this before. What's going on? Those little signals that your body's giving you that something is changing, get it tested, and time of your cycle is important kind of generally. So if day one of your period is day one of your cycle, then it's best to kind of get hormones days 18 to 22 to kind of get a level of where am I, like what imbalance is there at that point in your cycle.
That is so interesting. I know you brought up being in your 20s, potentially starting having to have kids. I have noticed just in my own community and circle of people, women in their 20s who are struggling with fertility in numbers I've never heard about before. And
Mhm.
is this a technology thing because we never really heard about stuff in the past? Is it because these pregnancy tests are so much more effective, so we find out so sooner and things don't go well and there's more cases or occurrences of miscarriages, but also just the number of PCOS, like I think, am I saying that right? Is it
Yep.
PCOS? Okay. Increase significantly. What does this all mean? How come we're going through this, do you think?
Well, I think there's many reasons why. I think there's definitely more endocrine disruptors in our foods. Now if we're going to jump and talk to men for a second, young men are not developing the testosterone levels that they should or used to. And so in women, we're seeing a lot of early hormone imbalance, which is definitely going to affect your fertility. And the PCOS, polycystic ovarian syndrome, definitely is on the rise. But again, the things that we're allowed to put in the food in this country, and you know, um, highly processed foods, low nutrient content, but also there's just toxins too. Cleaners, we're finding Roundup in our food, all those things really affect our hormones or how they can function. Even sunlight, we live indoors a lot. We're on screens, we're getting more blue light versus sunlight, and that affects, our skin makes hormones when it connects with the sun. And so as we've come indoors, we're seeing more hormone disruption for sure.
Oh man, I want to go down the rabbit trail of light therapy, but we'll save that for a future
Yes.
conversation.
Yeah.
So,
Right.
what would be some of the symptoms that somebody would need to find either a functional medical or hormone specialist in their area? What are some of those signs?
Well, I'm just it can be a wide spectrum of signs. And so some people don't know exactly what it is, but it could be increased anxiety and depression. It could be, a lot of women come in to me and say, like, I only have one good week out of the month now because the rest of the time I'm miserable, I'm moody, I have breast tenderness, I'm gaining water retention. Um, so and then there's the people at the blatant hot flashes and night sweats. Brain fog is a huge one. Can't focus. I think I have ADHD, um, forgetting things. But it could be other things like hip pain or, different that you wouldn't necessarily string together with hormones. And unfortunately, still to this day, a lot of my clients come in and are either told, like, we can't test hormones, there's nothing I can do for you, here's an antidepressant, here's gabapentin. And it's my favorite thing. Like, I had just somebody come in yesterday and she's like, I've been seeing you for 4 months. She's like, I am back to me. And
Wow.
it's like, if you give the body what it really needs, it can turn around.
That is so powerful. And I just got goosebumps on my legs because I think that we're over caffeinated. This is one of the things that you found out about me of how much caffeine I was drinking. Because being tired, that doesn't need to be normal sign of aging, and neither does like the hip pain just because you're aging and your forgetfulness, you're aging. So I think that it's so important that people really pay attention to their hormones. Okay, so if they're seeking a professional, what are the things they should ask for? Hey, can you test this? And the reason I ask that is because normal Western medical clinics might say to me, Katie, your thyroid is functioning perfectly. However, when I get my thyroid tested with you, your T4 is not converting into T3 or however that goes, right? So it's like,
Right.
what are the differences and what should people be asking for?
Right. So a more in-depth panel. So time of your cycle. So for or for hormones, you want like an estradiol, an FSH, progesterone, testosterone. Thyroid cannot just be TSH. That does not tell you anything about thyroid function. So it has to be that TSH, T4 free, T3 free. If you haven't tested it before, thyroid antibodies to make sure you don't have an autoimmune thyroid condition. If you're having weight issues or hormone imbalance, reverse T3, so getting that more in-depth panel instead of just the surface things that cost your insurance the least amount of money that they want to run on you.
Yeah. Okay, so I'm gonna throw a little wrench in there. I don't have this issue because I take a ridiculous amount of vitamins D, and I also do light therapy in my own form, as you know. But what are the ties to your vitamin D levels, your health, and the risks of not having the right vitamin D? And is this hormone related or not really?
Yes, well, actually, vitamin D is a hormone technically because our skin can make it from the sun. So technically, for it to be a vitamin, we cannot make it. We have to ingest it. So because our skin makes it, it is a hormone, and it does play very much like a hormone. So your immune system, your mood regulation, people with that low vitamin D have that higher risk of seasonal affective disorder, just energy. Bone density, heart health. It's a big breast cancer preventer. Like a study a couple years ago found that women whose vitamin D is in the 20s or lower have an 80% higher lifetime risk of breast cancer. And it really has a tie. Like this study was done just in men, but I think it was 2015. They did a study and found a correlation with men who have low vitamin D also have very low testosterone levels. So there's definitely that link there too.
It's just so interesting to me. We are in the middle of winter, at least here in the Midwest. So, if there were a couple kind of lifestyle shifts that listeners could take today that would make a positive impact on their health, besides eating clean food, what do you think could change for us? What do you typically advise your patients to do or take?
Yeah, well, people are always surprised because I'm not a huge proponent of taking a ton of supplements, but definitely ones that we know you need. And I always say, our bodies are amazing. And so when we find imbalances, the goal is to rebalance and then you not need to take supplements that your body just can function like it's supposed to. Um, and outside of eating clean, definitely physical activity. It doesn't have to be like an hour and a half in the gym, but even, 20 minutes of weights or Pilates or something. But getting outside, absolutely. Getting out in the light, even in the winter, a few minutes, get your eyes in the sun, get your skin exposed a little bit, get those hormones creating. Even in shade, we still get the helpful UV light that, helps with everything, our metabolism, fat burning, hormone balance.
One of the things about you I appreciate is that if you need to prescribe something or have it created at a compounded pharmacy, you have that ability. It's not just supplementation,
Yeah.
but how would you advise listeners, because we know in our heart that not all supplements are created equal, but how do you know something is actually good or not?
Yeah, well, it's a very unregulated industry, and I would say probably 98% of the stuff out there is not doesn't have the quality that it should, doesn't actually include the ingredients that it says it does. So technically, just getting a product that you can only get at a professional's office is one of the best ways to guarantee. They try to have little, labels they put on good manufacturing, but I don't know, how good that is. But I think too, like working with somebody who really knows what you need, because I have so many people that come to me and they've been trying to do their own research and then they come in with literally two bagfuls of supplements that they read this is good, so they got that. And, before you know it, you have 250 different supplements. And that can't be good either. I always say, just like you can take too many prescription medications, you also can take too many supplements.
I feel like I used to be like that because I was like, more is better, but then that can be really hard on the liver and the kidneys.
Right.
So, yeah, well, I'll tell you one of my favorite things that I receive from you is testosterone pellets. Tell us a bit about that because I don't think a lot of women even think about testosterone. What is the role for that? Mine was ridiculously low,
Mhm.
and how you help women like me with testosterone.
Yes. So we don't think of testosterone as a female hormone. And I mean, you can even look at the Academy of Endocrinology, where they just won't acknowledge that testosterone is important to women, even though they know it is. And it has probably about, well, many, many roles in the body, from head to toe: brain function, focus, word recall, brain protection, helps your body heal, muscle strength, prevents you from injury, collagen production, bone density, muscle mass,
Sex
relates
drive.
to sex drive, absolutely. And so, but we don't have much compared to men. We have just a fraction of that. And we start to lose it around age 40. We also lose a percentage of testosterone with each pregnancy. And so, if you've had 3, 4 kids, by the time you're 45, you're pretty depleted. And one of my favorite things testosterone does is it's a very outside the brain protection. It's very good at preventing breast cancer. So androgens, testosterone are very breast protective. And so they've done studies where they've given testosterone to women with active breast cancer tumors, and that testosterone can help shrink those tumors up. Uh,
Wow.
so it's my favorite hormone. I always joke that I'm taking that to grave with me.
Yeah, and the pellets are like, and I'm gonna probably explain this incorrectly, so you please chime in, but they're like little tic tacs, and you kind of insert them in my upper butt.
Yeah, so there's several ways you can replenish or support testosterone or all hormones. Pellets are nice in that they can last up to 6 months, depending on the doses you can handle. So 3 to 6 months. They're just inserted in the subcutaneous tissue, and then your body utilizes that stash over the next few months. And so it's nice because you don't have to think about it. It's there. If you're working out harder than normal, your body has that to pull from. If you're not, it just sits there. So it's a convenient way of not having to think of applying something every day or injecting yourself with something.
Gosh, you have so many tools in your tool belt. Like I just love working with you. I'm curious, like, do you see patients virtually? Are you able to work with people throughout North America, or what do you typically do?
Yeah, I am, because I do not work with the insurance industry. So we do phone calls, Zoom calls, whatever works. I mean, I have a population of people who live in areas where there is no resources for them. And so I'm their person.
And then how does it work for the blood work part of that? Because what I love is
Yeah.
with you, I can come in and all my blood work and all my testing is done right at your
Yeah.
location.
So we just send a lab order, email them a lab order, and they can find a lab near them. To be careful with that, some labs cost a ton of money. I try to keep my lab costs low, but usually people can find a lab near them that they can go get the lab work drawn, and then we just go over the labs virtually then.
I know that this is going to require a whole nother conversation. So I want you to come back again because I know that people, especially in this industry, working with so many different types of products and not all of them, as much as we want and desire, are clean. So that we are around toxins a lot in this industry. But I want to, and I don't want to open the Pandora box too big, but just a quick overview of how important is gut health and the microbiome, because this is kind of a new coined term that we're hearing more and more about. Can
Right.
you give us kind of the quick and dirty overview of what does that mean?
Well, I think we'll see in the next few years that the gut and microbiome will play a critical role. I think that and probably light will be the big things that really affect human health. And we just have so many insults to our gut microbiome, and the gut regulates everything. 80% of our immune system, 90+% of our serotonin is made in the gut. Every hormone is made and detoxed through the gut.
Is
We now
serotonin like your happy drug, like your mental health happy drug, or is that
Yeah.
different?
Yeah, so like a lot of people who need an antidepressant are low in serotonin. I mean, there's other neurotransmitters, but most people know serotonin. Um, and so it's critical to everything. We now know that the bacteria in your gut talk to your brain through the vagus nerve. And so what bacteria is in there is going to affect mentally how you're feeling. So, and we have so many insults to our microbiome today, even just artificial sweeteners can, or um, antibiotics. I mean, kids are given it all the time. Maybe we're doing better now, but our generation was here, have an antibiotic, um, ibuprofen, anything that can create a disruption in that microbiome, and then it disrupts all of that function. We even have cortisol receptor sites in the gut, so it affects your anxiety or your fight or flight response too.
Interesting. So ibuprofen is an NSAID. Is the NSAID the bad part of it?
Yes, yeah. Yep. And even, everybody's on Ozempic today, right? And that's technically a peptide our gut should make, GLP-1. And when we study, most of us are missing strains that help our gut make those GLP-1s naturally. Or we've got high fructose corn syrup, which actually blocks GLP-1. And so, we're just kind of missing a lot of things that our ancestors had, and that is going to impact how your metabolic system works, how your day-to-day hormone function, how your cortisol response is.
What would you say your number one mission is for the patients you're working with in 2025?
What it always is, to restore their health. I always tell them I want you to graduate and not need me. Restore their health, meet them where they are. You listen to a lot of people on podcasts or people in the functional medicine space, and they're like, oh, you do this, and you have to meet the person where they are. So whatever their concerns are, what's bothering them most, and that's why we talk about, like, yeah, I prescribe a lot of medications, because sometimes that person is at that end of their rope and they need to feel better fast. And so using my tools to make them feel better quickly so that we can work on the long-term process of restoring optimal health, really. I mean, even going back to the gut, we know certain bacteria slow the aging process, keeps your skin young and healthy. And if you're missing that, that's the whole inside out, right? Feeling good inside, but looking good externally too. So just helping my clients. My favorite thing is when they come back and say, I feel like me again. I'm so happy.
Yeah. Wow. You're amazing. And for everybody listening, I have a link in our show notes for you to visit Essential Health's website. So you can look at Karen, what she's has going on. Here's what I'm trying to say. I always tell this to everybody locally too. It's hard to get in with Karen, but once you're in, you're in. So, what's kind of a lead time, like reasonably, if somebody's trying to start to work with you, is your lead time typically 3 months out? What does that typically look like?
We try to keep it at 3 months. Yeah.
Yeah.
I think
So
right now I'm looking into April.
right. So thank the Lord I'm in, but once you're in, you're in. So you got to
Yeah.
start at some point. But of course, if you have somebody near you, that would be awesome as well. Karen, I definitely want to bring you back to continue these conversations because we in this industry need this resource to learn more about our health. Before we're done, do you have any final words of encouragement for the beauty and wellness pros that are listening today?
Well, you just have to be your own advocate. You know, Fortunately, we're in a time where you have access to a lot more knowledge that we didn't have, I'd say, even 5 years ago, where you have podcasts like you, or you have TikTok or whatever, where women can actually hear more than they're just being told at their doctor's office. And so you listening to that, utilizing those resources, and you do have to advocate for yourself. If you're not feeling like yourself, you feel like something is off, then something is off. And then you need to find what is off so you can correct that.
Well, thank you. I appreciate you taking the time. I know how busy you are too. So thank you for taking this time to be with me
Thank you
today. I
for
really
inviting me. All right, take care.
thanks you too. And thank you all for joining us here week after week. If you appreciate this podcast, please take a moment to leave us a positive review wherever you're listening so that more people like yourself will discover Beyond the Technique, where we're here to change the way that you are supported in your business. Until next time, have an awesome day and stay strong.